Hello class of 2019, this is Moses here. So I'll be one of several MedStar leaders for the school year. So I just wanted to give you guys just like a sample video of what you could expect from my MedStar sessions. So basically the topic that I'm trying to present is triacylglycerols and lipoproteins given by Dr. Sutherland. So just beginning off, so basically there are sources for the lipid content that's in the plasma, right? So basically from our diet, so if we eat a lot of fat rich content or whatever, so basically this fatty content will eventually get to our intestine, and the intestine will absorb it, the free fatty acids, and as the free fatty acids gets into the intestinal cells, it's going to reconverge with glycerol, and then you're going to have your triacylglycerol. And this triacylglycerol, in combination with cholesterol, is going to be packaged with apoprotein B48, right? To create chylomicron. This chylomicron enters your lymphatic system, and then eventually it enters into your circulation. All right. So this chylomicron that enters into the circulation, as it moves, the cells in your body are going to release free fatty acid from it. But primarily the chylomicron is going to be headed to the liver and to your adipocytes, right? So this is one source of the lipid content in the plasma. Now another source of the lipid content in the plasma is from your fat cells or adipocytes, right? So we know that the adipocytes, they're basically like a storage house of triacylglycerol, right? So basically the adipocytes can break down their triacylglycerol content. All right, so they can break down this content, and they break it down using hormone sensitive lipase. All right, so by utilizing hormone sensitive lipase, they can break down the triacylglycerol and release free fatty acids. All right, so eventually it'll be broken down, not necessarily by hormone sensitive lipase, but another hormone, into glycerol. So the free fatty acid and the glycerol will diffuse into the plasma. Now the free fatty acid can just, it can't just like be in the blood, because it's not hydrophilic, right? It's lipophilic. So it needs to bind to albumin, and once it hitches a ride on albumin, then heads over to the liver. Okay, so basically the fat from our diet that is entering circulation in the form of chylomicron, all right, and the fat that is joined to albumin, that is being released by our adipocytes, right? So these two guys are going to head to the liver, all right? So what happens in the liver is that the liver is going to take the fat content, the free fatty acids, and the cholesterol, right, coming from these two sources, and it's going to produce VLDL, very low density lipoprotein, right? So VLDL is then released into circulation. Now, what the liver does is that the liver produces this VLDL, and it uses apoprotein B100. Remember, what we saw in the intestine was apoprotein B48. The liver is going to be using apoprotein B100. So the VLDL is released into circulation, and eventually, as it moves throughout circulation, free fatty acids and cholesterol is going to be removed gradually. So we're going to go from VLDL to IDL to LDL. All right, so these when we're talking about VLDL, IDL, LDL, we're talking about liver to tissue cells, right? The tissue cells of your body. Now, so VLDL, IDL, LDL, they're gonna have apoprotein B100. Why? Because they were made from the liver. The chylomicron is made in the intestine, so it's gonna have apoprotein B48. So you wouldn't expect VLDL, IDL, or LDL to have apoprotein B48, because if they had it, that would mean that they're synthesized in the intestine, but they're not, so they don't have it. Okay, so VLDL is mainly going to be transporting fats to your adipocytes. So I want to kind of maybe a better way to kind of say this is that you're not going to be seeing LDL transporting free fatty acids to your adipocytes. It's primarily the LDL and IDL that's going to be transporting free fatty acids to your adipocytes. Now, we also have the HDL, right? Now, the HDL is going to be transporting cholesterol, right, from the tissues to the liver. So it's like VLDL, IDL, LDL from liver to tissues, then from tissues to the liver, we're using HDL. All right. So another way to think about this is H maybe you can just a little mnemonic, headed to the liver. So H for H on the HDL and L for the L. So headed to the liver. Just a little way of remembering this. All right, so we're just going to consider a couple diagrams here. So just like what I just said. So the intestine, from the intestine, we're going to be absorbing fat content. The fat content in the form of triacylglycerol and cholesterol combined with apoprotein B48, right? And this is how we get our chylomicron. Chylomicron moves through our lymphatic system, right? So it's absorbed through the lacules, goes to the lymphatic system, it's dumped into the circulation, and as the chylomicron moves through circulation, the fatty acids are removed via the action of lipoprotein lipase, all right? Lipoprotein lipase. And eventually, as that happens, the fatty acid content of the chylomicron steadily decreases, and then we end up with the chylomicron remnant, which heads back to the liver. All right. Now we said that the liver is going to be receiving fat from the chylomicron and from adipocytes, right, in the form of free fatty acids bound to albumin, right? So once the liver receives the fat content from these two sources, it produces the VLDL, right, which we see here. Now remember that the VLDL is joined to what? The VLDL is joined to your apoprotein 100, right? Apoprotein 100. Right. So VLDL is going to move through circulation. Eventually, free fatty acid is removed. Then you get IDL, free fatty acid is removed. Then you get LDL, which goes back to the liver and to some non-hepatic tissues. Right. This is just another diagram. So dietary fat and cholesterol moves through the intestine. It's taken up by the intestinal, the enterocytes in the intestine. Once this gets into the cells, it's joined to apoprotein 48. You get your chylomicron. Chylomicron moves through circulation. You use lipoprotein lipase to release the free fatty acid, and it free fatty acid goes to your adipocyte, and you get your chylomicron remnant. And the chylomicron remnant heads back to the liver. The adipocyte can release its free fatty acid via the action of hormone-sensitive lipase. Free fatty acid is joined to albumin, right? Because it can't move in the circulation by itself, and it heads back to the liver. Then once in the liver, once this stuff is in the liver is going to combine the fat content, and it's going to push out VLDL. The VLDL is going to have apoprotein 100 on it. VLDL goes through circulation. Lipoprotein lipase is going to release free fatty acid from it. You get IDL. Further free fatty acid is released from IDL, and we get VLDL. VLDL can go to tissues, or it can go back to the liver. Okay, so now let's specifically talk about what exactly are these lipoproteins. So the lipoproteins is essentially the body's vehicle for moving triacylglycerol and cholesterol, right? So just looking at the morphology here, so we can see that it's a sphere with stuff in there, right? So it's a sphere with stuff in there. Now, what the components of the sphere? So we have the phospholipids. So we can see the phospholipids here, right? We have our apoprotein, right? And we have cholesterol. Inside of your lipoprotein, we're going to have triacylglycerol, which we can see here, and we're going to have cholesterol esters, which we can kind of see here in yellow. So these lipoproteins, VLDL, IDL, LDL, they're going to have apoprotein C2. All of them are going to have apoprotein C2. Now, apoprotein C2 is on lipoproteins, and it's also on chylomicrons. Now, I just want to be sure. I want to see if it's, I don't think it's on LDL. Okay, actually, it is on LDL. I mean, HDL, I meant HDL. Okay, so it's also on HDL. So basically, C2 is on everything, right? Okay, so what is the function of this apoprotein C2? So basically, apoprotein C2, it allows the lipoprotein lipase to bind to this lipoprotein and release the free fatty acid, which is done by breaking down the triacylglycerol, right? This is just another depiction here that I have. So here we have VLDL, right? So we know VLDL is coming from our liver, right? It's the first thing that's released from the liver that goes to IDL, then it goes to LDL, right? Then LDL can go into tissues, or it can go back to the liver. This VLDL moves through the circulation, and what happens is that, so here we have endothelial cell plasma membrane. So we're assuming that this is blood. This content here is blood. So we have the lipoprotein lipase, all right? Lipoprotein lipase is basically on tissues. Well, let me see a better way to. So hormone sensitive lipase is only found with adipocytes. Now the tissues are going to have lipoprotein lipase. And specifically, this lipoprotein lipase, so it's not inside the cell. So it's basically secreted, and is on the endothelium, right? So here we can see this lipoprotein lipase, right? So it's bound to heparin, and it's just there on the endothelial surface. So this LPL is going to act on this VLDL. So it's acting on this VLDL, and it's going to cause the release of free fatty acid, right? Once the free fatty acid is released, Then from there, you can just move into the cell, right? Just move right in. Slide on down. Okay, so this is just a depiction of that. All right, so this is just a little overview. I don't want to spend too much time on this. So I will go through the rest of this during my MedStar session. So I will be having my MedStars on Thursdays. Just so if you forgot my name, so I'm Moses. We'll be in TBR rooms, most likely in the afternoons, right? All right, so I hope you learned something from the video.